Hey there, I'm Dr. Barbara Woods, and I hope you are having a wonderful day. We're back with the Intergenerational Trauma Therapist Show podcast, and we are going to talk today about what the roadmap is for specialization in treating intergenerational trauma, because it's actually quite complex, and this is why these cases feel so overwhelming when you're working with them without an efficient and effective framework. So it's really important to specialize in treating these cases because of the complexity and the degree of difficulties that the families have been through for multiple generations. So having specialized knowledge and skills is really critical to have effective therapy. It's also critical to have efficient therapy that gets some calm or some regulation into the family system right away so that they have hope and they feel like this is a good intervention for them, because they've been dealing with these things for so many years, so many generations, that they may not believe it's true that healing can happen. They may think this is just what life is about, with all kinds of chaos and conflict in the family and difficulties with attachment, but there's a different way. So, the reason this is so complex to treat intergenerational trauma is because of all the areas that you have to have some specialized knowledge in. So, this includes understanding intergenerational trauma itself, how it's transmitted, how it shows up, the dynamics it puts into a family, how it impacts the parent, how it impacts children and teens. So, that in and of itself is a fairly large area. But when we're intervening in these families and supporting their growth and healing, we also have to know some family therapy skills, because that's basically what we're doing. Is intergenerational trauma therapy is basically a specialized type of family therapy. So we have to know about systems and all those dynamics that happen in families and are kind of under that specialized umbrella of family therapy. Then, because the children are impacted by usually by attachment disruptions and trauma, we have to know child and teen therapy and attachment interventions, so that we can address what's happening in that child and stop the transmission of intergenerational trauma. We also have to have skills in treating complex trauma for the parents' unresolved trauma, because this is really the key factor in transmitting intergenerational trauma in families. And it's the key factor where we can intervene and make some positive changes. So, because intergenerational trauma directly impacts attachment, we have to have all those interventions. We have to have really good skills in how we apply these in these complex situations. Another thing that can be really difficult is engaging the parents and building their skills, because these parents sometimes have had a lot of professionals that have blamed them or said that they weren't doing enough, and they're really doing the best they can with what they got. So we have to know how to effectively engage parents in therapy. We also have to put in some innovative therapy approaches so that we have an option other than the traditional trauma work, because it really doesn't work in these situations. You can use them in conjunction with an efficient and effective framework for intergenerational trauma, but trauma interventions alone aren't going to address all the dynamics in intergenerational trauma. So we also need to have case consultation and supervision, because these cases can be kind of overwhelming and difficult. There's a lot of sometimes crisis and chaos that we may get caught up in, and we won't see a pattern or something else that may be really important and maybe kind of the bullseye for intervention, where it will help the family either have better attachment or more regulation. So it's really important to have that consultation and supervision. And of course, we have to have continuing education, because there's always new interventions coming out. There's always new science that we have to be able to incorporate and to stay fresh in our skills. And last but not least, we need a lot of professional and personal self care, because these are some challenging cases. you can really start to feel like you're running all over and not really making any progress. So it's important to really take care of yourself as well. So we're going to go into the first part of understanding intergenerational trauma. We have to have a comprehensive understanding of what intergenerational trauma is, how it's transmitted, and how it impacts the families. What you'll see when you're working with families impacted by intergenerational trauma. The way that this can happen is you can do literature reviews, read a lot of books, all these things that really are kind of overwhelming because there's not really a streamlined book on treating intergenerational trauma. There are some books on how it impacts families, but it's kind of an area that doesn't have a lot of literature specifically on intergenerational trauma. So you can go to relevant conferences and workshops, which you'll get some skills, but they will be that piecemeal where it'll be attachment or complex trauma or child and teen therapy, but it's not going to be a cohesive whole for the whole family system. So it's a problem that it's pieced together from so many different resources because then the therapist has to sift through all that and try to find ways to put those together to make it work the best so that it's efficient and it's very effective. Learning all these pieces of how to put these together and all these different categories of specialized knowledge that we need to have took me over 13 years to put together. So it takes a long time, and these families don't have that much time because by 13 years, kids will probably be on their own, and then those patterns will continue. So we also want to have knowledge and skills for family therapy because there's a huge role of family therapy in treating intergenerational trauma. So we have to have those advanced techniques in family systems, in identifying coalitions and triangles and all those things that can really happen not just in one generation, but in several generations back. That knowledge and skill is so important because you're dealing with multiple generations in a family sometimes. These cases are really complex and they have a lot of layers. When you have a family that's been impacted by intergenerational trauma, maybe two generations ago, the effects kind of compound over time. So it gets really overwhelming for the family, but also for trying to intervene in therapy as well. Again, you need case consultation and supervision for that as well. So, focusing on child and teen trauma therapy is a really critical part of addressing intergenerational trauma because the child and teen's behaviors are going to trigger the parent's unresolved trauma. It's also going to draw a lot of attention from people in the community, in the schools, doctors, child welfare, child protection services. It's really important to address that child and teen trauma. So we need specific training and intervention and how we treat those and address trauma impacts just on the child. But we also need information on developmental trauma, and we need to have very specialized knowledge in that area because the difficulties that kids grow up with when there's intergenerational trauma, they have a developmental impact. And if you're not sure what that is, you could refer a child that is experience hypervigilance and you refer them for ADHD. So we really need to have really specialized skills beyond those trauma interventions. And again, supervision and case consultation. Now we're going to move into what we need to do to support the adults, the parents, when we're working with complex trauma within a family system. Basically, when I explain this to other therapists and families, I talk about developmental trauma happening during usually first 3 years of life, but can be later as well, and it has a huge impact. There are disruptions in attachment or traumatic experiences that have a huge impact on different areas of development. When those go unresolved, when that person becomes an adult, it kind of shifts under the umbrella of complex trauma, which is rooted in developmental trauma. So that's that transmission where the parent has complex trauma, the child has developmental trauma. If that child's trauma isn't resolved or treated, it becomes complex trauma, and then their child has developmental trauma. So that area is the key for intervention. And the difficulties, if we don't address the unresolved trauma in the parent, we're putting all the pressure to heal on a child. And the child is growing up in a context where it may not have the supports that they need in order to develop in a different way and have those developmental milestones met and have all the integration of their experience. So if we treat that child in isolation, they have the burden of carrying all the trauma for all the generations past. And it's not fair to the child, and it's actually not very effective either, because the parent's unresolved trauma is part of that transmission process. But this is a no blame zone for parents because the parents never got the experience that they needed in order to have the skills to support their child. They're just kind of repeating what's always been in within their family system or what they experienced, and they haven't had the skills or opportunity to make some changes to get healing themselves and to move forward and have better coping skills, better parenting skills, and to get their trauma resolved. They just don't have the skills that they need. And this is a skill building thing. It's not that the parents don't care or they're not good parents. It's just how it is, and it's how it gets transmitted in families. So, the framework, because we're dealing with multiple layers and levels of trauma and intergenerational transmission and attachment disruptions, we have to have a framework for the therapy for the child, the teen, the adult, and the overall family that's consistent across those different people to make it more efficient. If we do EMDR with a parent and some trauma focused CBT with the child or teen, when you go to have like harmony between their interventions so that the parent understands and recognizes what's happening with the child a little bit easier, then we don't have that if we're using different interventions across the family members. So we really want an streamlined intervention has the same framework for all the levels in the family, the parent, children and teens, and the family overall. So now we'll move into talking about attachment and attachment interventions, how important they are for treating intergenerational trauma. These are one of the most important interventions because this is where unresolved trauma impacts the parenting and causes that transmission of intergenerational trauma. If we address the attachment disruptions in the current generation of parent child, it stops or prevents the transmission of that intergenerational trauma. This is a really key part. We can't influence genetics. We can influence brain development, but it's pretty difficult and indirect. But we can impact attachments and we can strengthen those and heal those, that it stops that transmission. And when we use attachment interventions, we are addressing the developmental trauma of the child or the teen. So it prevents further disruptions in the child or teen's life and development. So this is also a really important factor. This is why attachment is kind of the bullseye that we really want to make sure we address when we're working with families with intergenerational trauma. One of the areas that we have to have skills in is engaging the parents effectively in therapy, in their own therapy, in their child's therapy, and giving them the motivation and the skills and the tools that they need in order to make changes in the family system and in their relationships with their kids. But these relationships can be really challenging because parents who are impacted by intergenerational trauma typically have impacts in their learning and their school experience that when they have kids, they may not trust the school. They may not feel like the school has their child's best interest in mind, or they may not feel like they even care. So it's really sometimes hard to engage parents because they've gotten so many messages that they're not doing well or they're not good enough. So they may be a little bit hesitant or defensive when they do get involved in therapy. This will be especially with professionals. If they're involved in child welfare or child protection, those are agencies that intervene in family systems that by nature, they're kind of a hostile relationship because of the threat of removing kids or telling them they're not doing well. These families have a lot of experiences where they've been given messages that they can't trust professionals or that they're just going to get blamed. We need to make sure as therapists we have a different approach to that. The strategies for ending the transmission of intergenerational trauma, they're critical of any piece of this intervention. And that's why the intergenerational trauma program starts with increasing the self-regulation in a parent and having co-regulation between the therapist and the parent so that they get a new experience in relationship that they can then use with their child. So as we're teaching and building their skills, we're starting to address their trauma at a root level, at the level of the autonomic nervous system and relational neuroscience, neurobiology. And then we're moving into attachment, co regulation, all of those. So it really builds the parent's self regulation and their capacity to support their child. That's the foundation of stopping the transmission of intergenerational trauma. Another area that's really important to have is exploring innovative treatment approaches and working these into the framework that you're using. So, very few interventions for intergenerational trauma are specifically designed to meet the unique needs of this population. They're kind of piecemealed together. So, they'll treat the complex trauma in the parent, they'll treat the developmental trauma in the child, they'll treat attachment, but they're not all kind of woven and integrated together. There's one intervention that I've seen that's specifically for intergenerational trauma, but it's very outdated. It's got no incorporation of polyvagal theory, neuroscience, or relational neurobiology. It's only in one, like CBT and behavioral interventions, which we're finding aren't as effective and they actually can cause harm to some of these families and kids who have histories of trauma. The problem with innovating and exploring these approaches is that he'll have to take years to develop the skill set and integrate it into effectively treating intergenerational trauma. Remember, it took me 13 years to kind of learn how to effectively do this. I've had I've had 20 years of practice. So this is this is really a difficult thing. I don't want you to have to take 13 years and be 20 years into your career to be able to treat these cases efficiently and effectively. The next area we're going to talk about is the importance of very continuous case consultation. We really need in these cases to rely on peers, consultants, supervisors to really be able to see all these patterns because you can get very easily distracted in some of the chaos that happens. And then we're putting out fires and we're not actually getting to the root of the problem. This is where having a consultation group or a supervisor can really help you see those patterns because they're not involved in the system with the family directly, but they'll see those patterns from being indirectly involved. Regular participation in these groups gives a rich resource for identifying some of the more nuanced difficulties that these families are having. So it's really important to identify those nuanced difficulties that we may not see without extra support and supervision and consultation. Now we'll continue with pursuing continuing education because we need to keep our skills fresh. We need to stay current in literature because of the complexity of the family. So, if you've got 6, 7 areas that you need to specialize in: complex trauma, trauma for children and teens, therapies, attachment, all those areas, there's a lot of new and improved interventions and research studies that you have to stay constantly updated within the profession. You also need to constantly hone more nuanced skills. So you may find that once you specialize in intergenerational trauma, you'll start to get clusters of referrals that need more specialized therapy. So this may be refugees, people who are displaced. You may have to learn about different cultures. That is really important as you become more specialized. You may get referrals that require extra skills and training. So we're always going to need to be doing some continuing education. It's a lifelong learning in this field. The last area is personal and professional self-care. And this area is one that I think a lot of people overlook because, like, we're therapists, we know how to cope, we can take care of ourselves, and then we'll hit a wall of burnout. And these cases are very, very prone to burning therapists out, burning social workers out because of the complexity, because of sometimes hostility of people who are defensive because we're trying to get into their family system in some way and change it, that we really need to take care of ourselves. And that actually makes us better therapists as well. We need these strategies to prevent burnout, and we are very high risk for those because of the intensity and complexity of these cases. We're also at very high risk for secondary trauma due to the level of trauma and the breadth and the depth of trauma that people are experiencing. So these cases have some of the most impactful traumatic experiences that I've seen. And there's multiple pieces of that. So there might be generations back, historical things that have happened with their family, might be in the grandparent and parent relationship that there's trauma for the parent or the grandparent. And then you've got the child level where you're dealing with all of those generations of trauma. So the risk for secondary trauma when working with intergenerational trauma is much higher because of the intensity and the severity sometimes as well. So we need the right interventions and the right supports to make sure that we don't get burned out and that we're effective in our treatment. Once again, I will recap the roadmap of specializing in intergenerational trauma therapy. We need to understand and learn about intergenerational trauma itself. We need family therapy skills. We need therapy skills for treating child and teen trauma. We need therapy skills for treating complex trauma. We need to know about attachment interventions. We need to know how to effectively engage parents and build their skills when they may be quite defensive or guarded against that process. We need to incorporate and learn innovative therapies to stay on the cutting edge and right with the science. We need that case consultation and supervision, continuing education, and absolutely self-care. We have to integrate this new knowledge, seek support, and really prioritize that self-care. The intergenerational trauma program weaves all these factors into one comprehensive framework that is consistent across parent interventions that are targeted at increasing their autonomic regulation and increasing their attachment and parenting skills. Then the complex trauma interventions for the parent and the interventions for the child and teen and family resilience, those are all within the same vein. They're very interconnected, and it's a seamless process between parents and children, or between the parent and the family interventions that we do, or the child and the parent. All of that is streamlined and consistent so that there's a common language. There's common things that they'll be doing in therapy, but they'll be age appropriate and within their developmental level. So I would love to hear if you have any feedback or any ideas for any kind of future episodes. Next week, we are going to talk about transforming the frustrated therapist because of all these impacts and all this complexity into a connected and courageous master therapist. So I appreciate you watching and I hope you have an amazing day.